So Trazodone is an antidepressant that's used for sleep? Yes, it is. And in fact, it's quite effective. So in today's video, we're going to talk about Trazodone or Desyrel and everything that you need to know about it. So stay tuned. So starting with number one, what is Trazodone? Well, Trazodone is an antidepressant, and it's a serotonin 2 antagonist and reuptake inhibitor. So as the reuptake inhibitor, it works a lot like the SSRIs, blocking the reuptake and release of serotonin, allowing for more serotonin available in the synapses. However, that action is not as potent as the SSRIs. In fact, its primary actions are where it potently blocks the serotonin 2 receptor sites, and primarily serotonin 2A, which helps with enhancing slow-wave sleep, and serotonin 2C blocking, which with other antidepressants that have this mechanism, as you know, it can increase dopamine and norepinephrine in the prefrontal cortex. Now, it also has some antagonist actions in other receptor sites, such as the 5-HT2B, 1D, and 5-HT7 receptor sites. However, the reason it's used for sleep is because it also has actions on the alpha-1 and alpha-2 adrenergic sites as it antagonizes or blocks those, and it also blocks histamine. So it has those antihistamine properties. Now, this combined with the serotonin 2A or 5-HT2A blocking or antagonism actually has some powerful sleep enhancing effects. If you recall the video that I did on Seroquel, similar to that, small dosages can actually produce that hypnotic or sedative effect. Because in small dosages, you're going to be mainly targeting the alpha-1, alpha-2 antagonism along with the histamine blocking and 5-HT2A blocking. So in dosages of 25 to 150 milligrams, you're mainly going to be using those for insomnia or those sleep benefits or sedative effects. Now, the antidepressant effects are going to be seen in greater dosages, so above 150 to 600 max. And so though the higher dosages have an antidepressant effect, it can also be very sedating, which makes it a little more difficult to tolerate. So let's go to number two. What is Trazodone used for? Well, Trazodone was FDA approved in 1981 for the treatment of major depressive disorder. However, as you guessed, it's used off-label for the treatment of insomnia, also used for nightmares and anxiety disorders. And so number three, how long does it take to work? Well, for the sedative effect to help with insomnia, it's immediate. As soon as you take it, it usually takes about an hour before you start to notice the effects, and then you're already in bed and sleeping. However, for those antidepressant effects, that's gonna take 2 to 4 weeks, just like all the other antidepressants. However, it may take up to 8 weeks before you realize the full benefits of its antidepressant effects. And like I mentioned earlier, those are gonna be seen in the higher dosages from 150 to 400 max. However, you can go up to 600 if you're being observed by a professional and monitored. Most of the times those high dosages are used in a hospital setting when you're going above 400 milligrams. Now, because of the short half-life and the strong sedative effects of Trazodone, it has to be dosed twice a day when you're going into those higher dosages. And again, dosing during the day can make it intolerable for some people. However, there is an extended release form of Trazodone, which may be a little more effective or beneficial for people who can't tolerate those sedative effects during the day. And these tablets come in 150 milligrams and 300 milligrams extended release. And so number four, is Trazodone addicting? Well, it's not addicting like a street drug would be addicting, like cocaine or heroin. However, as I described in my video on antidepressants and addiction, it can cause neuroadaptation. And so when this happens, there is a physical dependency to the medication, and withdrawal effects can occur with long-term use, at least 3 months or longer for most people. And so therefore, coming off of it slowly would be a best option if you're on it for longer than 3 months. And so number 5, What are the side effects of Trazodone? So the most common side effects seen in greater than 5% in the FDA trials and twice as that of placebo are the following: edema, blurred vision, syncope, which is fainting, drowsiness, of course, fatigue, diarrhea, nasal congestion, and weight loss. So not a lot of weight gain with this medication. Now, some rare but dangerous side effects are, of course, the black box warning of suicidal ideation and all of the other rare and dangerous side effects that I talk about in my video on the top treatments for major depressive disorder. So go ahead and check that out if you haven't already seen it, but that goes over all of the common rare but dangerous side effects with all antidepressants that would apply here. But those that are specific to Trazodone are the following. And number one would be priapism. So Trazodone has a very low incidence of sexual dysfunction, but can cause priapism. Well, what is priapism? Well, priapism is in a male having an erection for more than 4 hours, and it's very, very painful, and it requires emergency medical attention to have it reduced or to have the blood drain out of the penis. Now, this has been said to occur in 1 to 8,000 men. So that is something to consider if you're a male and you're thinking about taking Trazodone. Another rare but dangerous side effect can be cardiac arrhythmias, where Trazodone has been shown to increase that QT interval, so that can lead to those arrhythmias, which can be lethal. Orthostatic hypotension, and this is when you stand up and then your blood pressure drops, and that actually is a cause or can be a cause for that syncope or fainting in the morning. So to help avoid this, you would want to sit up at the side of the bed before you wake up, dangle your feet and get the blood flowing to your brain. So that can help minimize the syncope or this orthostatic hypotension which can occur. And another rare side effect can be angle closure glaucoma. So make sure you're getting regular eye exams. Now, let's talk about drug interactions. So Trazodone is primarily metabolized by the CYP3A4 enzyme. So you're gonna have to be careful with those inducers and inhibitors of that enzyme. And so, of course, with inducers, you're inducing the metabolism of Trazodone, making it not effective. And with inhibitors, you can inhibit the metabolism, making you more prone to side effects of Trazodone. You also want to avoid the MAOIs or monoamine oxidase inhibitors because that can lead to serotonin syndrome or hypertensive crisis. And speaking of serotonin syndrome, you want to be careful with using other serotonergic drugs like other antidepressants along with Trazodone, as that can increase your risk for serotonin syndrome. And if you're not sure what serotonin syndrome is, I have a video on that, so make sure to check it out. So you also want to avoid the use of alcohol because it's a depressant and also very sedating, as well as combining this with something like the benzodiazepines or even barbiturates. So any central nervous system depressants should be avoided because it's only going to enhance those depressive effects, which can be dangerous as this can decrease your respiration rate and lead to death. Now, Trazodone has also been shown that it can increase levels of digoxin, which is an antiarrhythmic drug, and phenytoin, which is an anti-seizure drug. So if you're taking those medications with Trazodone, you need to take it with caution and monitor your drug levels. It can also affect bleeding time or the INR, so patients taking Coumadin or warfarin will also need to monitor their blood levels as well. And you must also use caution with those medications that can increase the QT interval because that'll put you more at risk for that side effect and cardiac arrhythmias. So, what are my final thoughts on Trazodone? Well, Trazodone is a great medication for those patients who have depression along with anxiety and insomnia. However, it's not good as a standalone treatment for depression because it's not well tolerated because it's so sedating. So I primarily will use this in small dosages just at night to help my patients who have insomnia along with their depression or anxiety. I use it in small dosages and for short term. And now I also must say that before starting any medications for mental health symptoms, you always want to look for the root causes of your mental health symptoms, as I discuss in this video. It may actually save you from needing to start medication in the first place. So there you have it. That is my overview on Trazodone or Desyrel. Do you have experience with taking this medication and you'd like to share it? Well, drop your experience down in the comment section below because we learn from sharing each other's experiences. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.